viewers, I'm back again. In continuation to what I was telling you before regarding the nutritional management of type 2 diabetes, I am once again coming back to tell you about the pharmacological therapy. There are so many medications out there to take care of type 2 diabetes. We have the first line medication, which is the metformin or the glucophage, like we commonly call it here in Nigeria. We have the other ones, the sulfonylureas, like the clenbuterol, the Clanil, or Dianyl. We have the glycoside, we have the glimepiride, so many of them out there, which we give to people with type 2 diabetes. We also have insulin, but somehow insulin, except recently, and by the help of my NGO, people begin to accept insulin. And, as one of the means or medications to take care of type 2 diabetes. It is predominantly used by those with type 1 diabetes anywhere, but also people with type 2 diabetes, they use insulin depending on the duration of your diabetes as a person and also the level of control you have over it. But also, people have different myths about injecting insulin. Some people will tell you that it is addictive. Some tell you that it increases their body weight. Some will also tell you it can cause hypoglycemia. And a lot also will tell us it can cause death. All these are myths. A lot of people who have joined my NGO, Hammer Home the Glucose, have benefited from the insulin supply we get from the United States. And that has given them a lot of hope and belief that they can live the next day. Prior to the use of insulin, a lot of people have also died believing that the only way to take care of the diabetes is by taking oral hypoglycemic agents or the tablets I mentioned earlier on. They are also good. They are also in use, especially when you have a moderate control of your type 2 diabetes. You can also use the oral tablets. But if you're out of control, the best way you can bring yourself back to life and also to a good level of control is by injecting insulin. Insulin, to a lot of people, is the next hope after God. Because of their size and other, they think that the amount of tablets they're taking is not enough to take control of their diabetes. Insulin does a lot of good job. We have also those who are taking the oral tablets. Some of them are managing it very well, but most times, because of the limitations we have in the efficacy of the oral tablets, it doesn't seem to do the job. We have a lot of fake medications flying around in this country. Most of them are coming from outside the country. Some of them are indigenous. But, you may be taking them and not getting the required results. A lot of people have also gone the traditional way by taking herbs. I don't encourage anybody who is living with diabetes to go through using herbs and traditional medicine to cure it. Up till now, it has not proven any good result, you know. During this period of time, you concentrate on taking herbs. Um, the complications are always much. By the time we realize what is going on, we have entered into one type of complication or the next, and the resultant effect most times is death. I continue to encourage people. There are a lot of oral hypoglycemic agents in the form of tablets, which we can take. I also have inhaled insulin, which I also get from the United States. So my NGO, our preliminary job is to make sure we encourage and help people that are living with type 2 diabetes, and also help them to continue to fine-tune their way properly, even in the type of medication they use, and also the type of food they eat, to make sure get desired results from for their diabetes. So um, oral hypoglycemic agents also work for a duration of time. At a point, it doesn't work anymore. Even when you are taking the most efficient and effective one, over time, the production of insulin from the beta cells or in the isolates of Langerhans starts decreasing. And the only way you can sustain your livelihood is by injecting exogenous insulin. So let us not think that if you start injecting, it means you're going to die soon. Or it may lead you to all this belief that we have. So I believe we need to re-educate our mind and believe that yes, insulin is the job. In my next video also, we'll continue to fine-tune, we'll continue to also tell you more about the medications we take or we should take when you have diabetes. In my next video, I'll be telling you about the complications of diabetes and how you can take care of yourself. Thank you so much, and watch out for the next video.